Welcome to Bad to the Bones, the podcast where we discuss everything related to orthopedics, joint health, and living an active lifestyle. Welcome back to Bad to the Bones. I'm your host, Debbie Rody. Today, we're diving into the topic of physical activity and how it influences bone and joint health as we move through the decades of adulthood. Joining me today is Dr. Eddie Wu, orthopedic surgeon with Premier Orthopedic Associates. Dr. Eddie Wu specializes in adult total joint replacement. He's super passionate about what he does, and today we really thought we'd take some time with him just to talk a little bit about how joint and bone health really helps restore mobility and get them back to their active lifestyle. So welcome back to the show, Dr. Wu.
Thanks for having me. Great to be back.
I know it's been a little over a year since we talked to you about total hip and knee joint replacement. And today we really want to talk a little bit about the physical activity part of, how you educate your patients so they can maintain better bone and joint health. So we really want to just dive in a little bit to the science behind why that matters. So we all know exercise is good for us, but many people don't really realize how movement and like the mechanical loading part of it is really helping increase bone strength. So let's talk about actually how does that? I mean, do you have some sort of simple explanation or just whatever developed explanation on why is physical activity good for our bones?
Yeah, that's a great question and a great topic. So it goes back to one of the most fundamental concepts that we learn when we're going through schooling and things like that. And it's something called Wolff's Law. So Wolff, it was named after a German physician. And that law, almost like a law of physics, is that the bone will respond to loading, right? So if there's weight bearing or there's loading to the bone, then the bone gets bigger or the bone gets stronger or more dense.
Okay.
And then vice versa, if the bone doesn't get loaded, the opposite happens. So then the bone gets less strong and less dense and more prone to weakening or fracture. So Wolff's Law basically dictates how the bone responds to loading or disuse.
So how does the body know that we're loading weight rather than our physical body weight?
Yeah.
Right? I mean,
the bone is used to your regular body weight.
Yeah.
Right. And so just like anything, you have to be stressed, right? Anything, any tissue, any skill, any system needs to be stressed in order for it to grow.
Yeah.
So the body is no different. The body's an amazing machine, right? Bones are dynamic tissues. So the body knows that, well, it's body weight, and after step after step after step, year after year after year, if it's not being stressed and it's just getting used to the same body weight, then it doesn't really change.
Yeah.
And so people that stress their bones or muscles, just like if you lift weights, go to the gym, they lift weights, they do different exercises, you're loading the bone in a certain way for it to respond.
Interesting. So if we get a little bit into like bone health through the decades and we take a look at maybe young adults in their 20s and 30s, what would you say is like, or would I be correct in saying that people are reaching their peak bone mass during that time of their life?
You would.
Okay.
It's kind of a depressing concept where people's peak bone mass is around 20, 25 years old, right? Mid-20s. And then after that, it's just a steady decline of how dense your bones are. And so it's really not about reversing that trend. It's about slowing down that trend.
Yeah.
So I would say mid to late 20s, that's when you reach your peak bone mass.
And so is it really important to start building that strength at in that decade then?
It is.
Okay.
I would conceptualize it as saving up in your bank account, right?
Yeah.
Your bank account is your bone. So you have your first 25 years, let's say, to build up as much density as you can.
Yeah.
And after that, you're going to start spending it. That's your retirement,
Yeah.
So if you can maximize how dense your bone is in your first 20, 30 years, you'll have less or you'll have more surplus to potentially lose as the physiological changes go on through life.
Are there particular exercises that are more apt to help someone build or maintain that bone strength in that decade? Because so many of that generation, I feel like, are into that CrossFit,
Yes.
It's like that heavy duty lifting.
I think there's benefit to any type of exercise,
Yeah.
And certain benefits are more evident with certain exercises. But To answer your question, I think weight-bearing loading exercises, especially dynamic loading with weights, right? Well, I'll oftentimes ask my patients, hey, what do you do for exercise? Oh, I walk. That's great. That's great for your cardiovascular system, but that's not necessarily good for building muscle and bone strength, right? So having a well-balanced exercise regimen similar to a well-balanced diet is really important. But to focus on muscle and bone strength, it'd be weight-bearing dynamic loading exercises.
That makes sense. And then as we're moving into our 40s, things are starting to, we're starting to decline, right? So what changes do we see typically in bone density?
Yeah, so just like we talked about before, there is going to be a decline. And at what rate you decline is really individualized based on lifestyle habits and exercise habits and genetics and gender. And so, hormonal changes also start to play a small role in their 40s and 50s, both male and female.
Yeah.
And so people become more sedentary in their 40s and 50s, generally speaking, because life starts to evolve however way it does, and people may or may not start to have kids, things of that nature. So between lifestyle and health, the bone density certainly starts to decline.
What would you say to someone who was able to lift pretty heavy in their 30s?
Sure.
Now they're in their 40s and their joints are starting to hurt, but they need to lift weights, right, to maintain that bone density. How do you balance that?
I would say, everything's pretty individualized. And so the goal is not to lift weights to a point where something breaks or you injure yourself, which we see, unfortunately, in the office from time to time. The goal is to see and adapt how much weight you're lifting to what you're able to do. So if you're only able to lift, if your maximum, and this is getting off topic a little bit, if your maximum one rep to do whatever exercise is, let's say 100 pounds when you were 30, maybe your maximum one rep when you're 40 might be 85 pounds.
Right.
And then you start working with that as a reference.
Yeah.
But there's nothing bad is happening if you can't lift as much as you did when you were 30.
Yeah. It's just going to help you maintain.
Versus when you were 20.
Yeah. Yeah.
Yep.
I mean, I'm sure you do see a lot of injuries from people just thinking, oh yeah, I could still go in the gym and throw that weight up.
Sure.
And
you see it all the time.
Yeah. And then we move into our 50s and 60s, and the bone density is doing what at that stage?
So the bone density continues to decline. And when I say decline, I don't want people to think that your bones will just all of a sudden, you're losing 20% every year. It's not like that. You may lose a subclinical amount where it really doesn't make a difference. And the way to do that is to have healthy lifestyle habits and be aware of what exercises you can do to slow down that. But in your 50s and 60s, the hormonal considerations certainly become more prevalent.
Yeah, I was just going to mention that.
Yeah, especially in females.
Yep.
The perimenopausal period and the menopausal period certainly starts to affect women.
Yeah.
Males, maybe not at the same rate, start to have less testosterone.
Yeah.
And so between estrogen, which lower estrogen levels with menopause and lower testosterone levels in males, they all contribute to an accelerated loss of bone density.
Yeah.
And so that bone loss definitely accelerates a little bit in your 50s and 60s.
This is maybe slightly off topic too, but do you find that some of your patients are pretty knowledgeable about this hormone stuff going on at that stage of life? Like, do they ask you about it?
They do. Some of them do.
Yeah.
And some of them do surprise me, particularly females. A lot of the females will ask me, and this is not necessarily within the scope of an orthopedic surgeon's practice, but they'll ask me about hormonal therapy or what medications do I need to be on to help prevent or slow down.
Or like, is collagen, all those collagen supplements, are they worth it?
You get questions like that all the time. And so my patients in general are very well educated. The internet's a great resource. Smartphones are a great resource.
Oh, yeah.
AI is a great resource. So they're very well educated on things that they can do to slow down bone loss.
So let's talk a little bit about some of the factors that do influence the bone density. We did touch a little bit on the hormone stuff, and I know you're not a hormone specialist, right? So the major factors, we did talk about the hormones, and for example, there's genetics and nutrition and lifestyle habits. I mean, is it worth expanding a little bit on how genetics and nutrition and physical activities impact all of
There
this
are,
too?
yeah. It's so important. And so genetics is one of those things where you can't really control.
Yeah.
Sometimes there are certain medical conditions that are very heavy into one generation passing it on to another or
Yeah.
putting someone at risk. So that's something that you can't really control. So it's really about what factors can we modify,
Yeah.
right? So exercise we've touched on already with loading exercises with weight,
Yeah.
getting consistent with that. Lifestyle habits are super important. So smoking is a huge risk factor for osteopenia and osteoporosis.
Okay.
And for our listeners, just to kind of give a background, osteopenia is a precursor of osteoporosis.
Thank you
So
for
if you,
explaining that, because I
yeah,
was going to ask you. I never
all
heard of
these
that one.
funny sounding words,
Yeah,
and they
yeah.
all sound similar. But osteopenia, when you get a DEXA scan, they'll look at your T score and your Z score, and then
Okay.
when you're approaching the osteopenia range, osteoporosis range, you're in the pre-osteoporosis stage, which is osteopenia.
Okay.
So for the purposes of this talk, we'll just use those two terms relatively interchangeably.
Yeah.
But lifestyle habits, so smoking's a big one.
Yeah.
Excessive alcohol use is a big one, right? Couch potatoes, those things are just not good for overall bone density.
Right.
Certain medical conditions, if you have a medical condition that requires you to take high doses of prednisone or steroids for a long-term basis, those can certainly weaken your bones.
Oh, wow.
And those things really have not only bone loss implications, but surgical implications too. So when we look at an x-ray or we're thinking about fixing a bone or replacing a joint where it requires instrumentation of the bone, and you look at the x-ray and the bone looks very thin,
Yeah.
and the patient's smoking a pack and a half a day,
Oh, gosh.
these are all huge risk factors for complications after
Yeah.
surgery. So it's certainly multifactorial to say the least.
So, are there certain skeletal regions of our body that are more vulnerable to bone loss?
There are. So if any of you that have had a DEXA scan done, many times they'll target the hip, right?
Okay.
Or the top part of your femur bone,
Yeah.
the wrist, your spine.
Huh.
And so those are areas that they look at and measure the bone density because those are most prone to fracture too.
Oh, wow.
So, you may have some thinning of the bone in your foot,
Yeah.
but from a clinical standpoint, the likelihood of you fracturing a foot and that becoming a clinically significant issue is low.
Yeah.
Whereas if you fall, people fall with their arms out, right? They break
Yeah.
their wrists. People fall on their side, they break a hip. They break their spine where they can't move. So those are the high risk areas.
So, when does an orthopedic surgeon in your position tend to get involved with someone with the osteoporosis? I mean, we've talked about the hip fractures and the humerus and, just all these different fractures. What point is it pivotal for you to get in?
Unfortunately, it's when an orthopedic surgeon gets involved, the bone has already broken.
Oh,
Unfortunately,
yeah.
yeah. And so we get involved usually when the bone has already broken and there's an issue,
Yeah.
because the screening part, if they're being screened for osteoporosis or they're being treated they're not seeking the help of an orthopedic surgeon.
Yeah.
So the most common times in the hospital, someone falls and breaks a hip, and that needs pretty urgent surgery. Someone falls
Yeah.
and breaks a wrist, that needs surgery. Oftentimes, not all the time, someone has back pain, they have a vertebral compression fracture. The proximal humerus is also considered an osteoporosis fragility fracture. So
Yeah.
we get involved when the bone, unfortunately, when there's an issue.
Yeah. So it's not like if someone gets a bone scan to test their density, it's like, oh, you should go see an orthopedist now because your bone density is low.
Correct.
Okay.
They should be seeing somebody. So whether that
Yeah.
be their family physician or an endocrinologist
Yeah.
or their OBGYN, whoever their primary care doctor is, to start treating the decline in bone mineral density.
Can you build your bone density back up when it's declining so rapidly?
You can build it back up to a certain extent,
Yeah.
but I don't think it's fair to say that if you're, let's say, 65 years old, you're trying to build it up through working out 7 days a week back up to a point where when you were 25. I don't
Yeah.
think that's really fair. That's
Yeah.
just not how the body works. But there's certainly ways to build it back up to a certain extent and also slow down the progression.
All right, let's talk a little bit about what the evidence says on exercising. Like we've talked a lot about scientific, how the bone is losing density and weight bearing. What, if you had to put it into simple terms, what are some of the just overstimulating things that people can do to really just preserve? I mean, like we've talked about it dropping so significantly, and there's only a little bit that you can do to build it back up. So like, what are people supposed to do to stay in a happy place?
Yeah, I think a very, as long as you're consistent
Yeah.
with anything in life.
Yeah.
If you're consistent with an exercise regimen
Yeah.
where it incorporates weights, resistance exercises, a healthy diet, a healthy lifestyle, right? The smoking, the drinking,
Yeah.
and you incorporate all that, and you're getting screened appropriately from your medical provider to potentially address some things that you can't change with the genetics and things like that. I think that's all you can do, and that's all you
Okay.
need to do.
What's multi-directional hopping?
So multi-directional hopping is kind of it's stressing your bones in a way that it's not being anticipated, right?
Oh,
So
okay.
stress makes you better, makes you stronger.
Yeah.
So stressing the bones with weights is one thing, but if you're just stressing your bones in a very predictable way, that's great, but that
Yeah.
may not be as good as stressing your bones, in a very controlled, chaotic way, in a multi-directional way. So let's
Yeah.
say, for instance, multi-directional hopping, I'm not saying everyone needs to go out and do this, but if you were to come up with an exercise routine or regimen where you're hopping with weights and not just doing squats 3 sets of 10, but you're doing squats in this direction and that direction
Yeah.
and backwards and in
Oh,
certain
okay,
planes,
gotcha. Yeah.
you're stressing your bones in different directions.
Yeah.
So it's getting used to different angles of loading.
That makes complete
Yeah.
sense.
So
Okay.
hopping is not, I can't hop, right? Nobody can hop. But multi-directional loading exercises is more the concept.
There's a trend on social media now of people our age trying to skip. Imagine
Yeah.
that. Like, that's pretty comical.
Yeah, well, I
Hey,
think-
can you show me how you can skip? People are like, what? I don't know how to skip.
Yeah, some people don't know how to skip. I've heard that too. But I
Yeah,
think
it's pretty
like
funny.
Zumba is another example where
Yeah.
where there's a lot of zigzagging,
Yeah.
and different planes of movement, and a lot of the elderly population really enjoys that. And I think that's great because you're stressing your bones and muscles and ligaments in different directions that they're not used to.
So let's talk about some of the terminology so it's concentric versus eccentric muscle, is
Yeah,
it?
concentric versus eccentric.
Eccentric.
So when muscles shorten, right? If people were to make a bicep, right, and let's say Popeye, right? Popeye
Yeah.
lifts up his arm and there's a big ball there, and I look how big my bicep is. That's when the muscle shortens, and the muscle's contracting and it shortens and it bulges up.
Okay.
That's a concentric contraction. An eccentric contraction means the muscle's lengthening. It's still working, but it's still lengthening, and the muscle's still working, but it's lengthening.
Okay.
So a good practical example is if you're going up and down steps, your quads, right? Your
Right.
thigh muscle.
Mm-hmm.
If you're going up steps and you're pushing yourself up a step, that's a concentric contraction.
Yeah.
When you come down steps and your thigh is on the step and you're lowering yourself down so your other foot can touch the bottom step, if you felt your thigh, it's hard, it's contracting.
Yeah.
That's an eccentric contraction. So eccentric contractions are always more work on the muscle than concentric contractions. So the best clinical example is, let's say after we do surgery, hey, Dr. Wu, I can go up steps one at a time, no problem, but I still have trouble coming down steps.
Oh, wow.
Well, it's
Yeah.
more work to go
Makes
down
sense.
steps, and almost all patients will say that. It's easier to go up steps rather than down steps. So
Very
then you tell
interesting.
we reassure them saying, hey, the going down steps will come. It's actually harder on your muscles.
Never thought of that. That's interesting.
Yeah, that's the most real life example that we see almost
Yeah.
every week. Yeah.
So I always thought that like building stronger muscle protects our bone, but like just overall kind of just, a little protective. But
Like a
that's-
cushion?
Yeah.
Yeah,
But that's
it
not really
does.
the case. Like working out actually is making the bone stronger, not
Yes.
just the muscle
Yeah,
bigger.
because the muscle's attached to bones and it's pulling on the bone and yanking on it and it's stressing it.
That's so interesting.
Yeah.
Definitely learning something here. I like this. All right. If we talk about some resistance training, it seems to come up again and again whenever we talk about health. Like adults want to maintain the bone mineral density. And I mean, what kind of guidelines? I mean, you talked a little bit about different sets. And do you have your patients, like, do you ever give them a guideline of saying, listen, this is what we're working on for you to keep you stronger. I would recommend these kind of exercises, this kind of repetition. Do you get into it like that, or you just keep it?
I would love to have more time in the office with my patients to go over that.
Yeah.
And that's why we have the expertise of physical therapists and personal trainers and things like that, athletic trainers. But in general, I think staying consistent is really important. So if you start off with just going to the gym once a week, great. And just as long as you do that once a week. And tailoring the exercise prescription, if you will, or regimen individually is important. So someone may not be able to tolerate 4 to 5 times a week, right? They may be only able to tolerate 2 to 3 times a week. And so I think a general rule of thumb, if you're consistent with it, maybe 2 to 3 times a week, and it's a well-balanced exercise regimen with weights, and again, consult a therapist, consult a personal trainer to come up with a tailored exercise regimen for you. That's somewhere to start, and then build from there.
Yeah. Well, as a joint surgeon, I know that there's certain cases where you may use bone density stimulators, or you don't.
We do, but usually not in the setting of joint replacement.
Okay.
So bone stimulators. So just to back up, when we're going through schooling, they teach us about Wolff's Law and how bones heal. So bones heal through, it's called a piezoelectric effect.
Okay.
And it actually heals through electrical signals in the bone. And so when, let's say you have a fracture and it's not healing fast enough, or it needs a jump start to heal, we often use bone stimulators that can either be ultrasound based or electrical based to try to stimulate the bone to jumpstart it to start knitting together.
Interesting.
So it's mostly used in the fracture setting, not necessarily the joint replacement setting.
Okay. So that's not used after surgery to help healing at all.
Only for fractures.
Okay.
Yeah. In my opinion. Yeah.
Okay.
Not a big role in joint replacement surgery.
So, Dr. Wu, as we're starting to round out this topic of, just the bone density stimulators, let's move on a little bit to lifestyle modifications. What are you seeing as best practice and some recommendations?
I would say, the concept of lifestyle modifications is multifactorial, just like anything is, but it's maintaining a healthy weight, right? And when we talk about weight, it's not necessarily the actual number, because taller people may need to be at a higher healthy weight than someone that's 5 feet tall. So then there's a concept of using a BMI, or your body mass index, which again, to our more educated listeners, isn't the be all end all.
Right.
But it's an index of how tall you are to how much weight you have. And, there are recommendations from the World Health Organization on what a healthy BMI is, and they're general guidelines. It's not the be all end all. And the reason why I say that is because muscle weighs more than fat, right? So if you have a football player that's very fit and very strong with 3% body fat, their BMI is going to be higher and considered quote unquote obese, even though they're not really obese. It's just because they have so much muscle on them. So it's a general guideline that medical professionals use to gauge what your ideal weight is, and that can be found on any reputable website. The other factor in lifestyle modifications or maintaining a healthy lifestyle is diet.
For
right?
sure.
And, you need the proper nutrients to heal a wound after surgery. You need the proper nutrients to build bone mass or maintain bone mass, and concepts and nutrients like calcium and vitamin D, and what the appropriate levels are, and what foods are high in those nutrients and vitamins and minerals are important. And so it's really everything, right? Maintaining a healthy lifestyle, exercise, healthy weight, healthy diet.
It's like a full-time job.
It's a full-time job.
It really is.
It's an important concept.
For sure.
That contributes to overall health.
So what would be your final advice to our listeners, who are going through these different, for each of these decades of trying to maintain, what is the best advice to try to maintain our bone density?
I think, just like we've alluded to before, I think maintaining a healthy lifestyle, and again, that's a multifactorial thing. Starting somewhere. No one expects you to get off the couch if you've never exercised before and go to the gym 5 days a week and just start throwing weights around. You're going to hurt yourself, right? But start somewhere, even if it's once a week. Consult the expertise of a personal trainer at the gym, or a physical therapist, or someone like myself that can maybe guide you along the way. But start somewhere and be consistent about it and then build from there.
Yeah.
Going once to the gym a year isn't going to do anything. But
Right.
if you go once a week for 52 weeks,
Right.
they start to add up. Now you go twice a week now, and things start to add up. So
Yeah.
maintaining a healthy lifestyle, diet, weight, starting somewhere as far as working out and creating an exercise regimen that's fit for you, using weights is what I would do. And obviously consult the advice of a medical professional.
Yeah.
to-
And good
great
sleep
for that.
too is important,
Good
right?
sleep is very important.
Yeah.
Yeah. I didn't think that
I'm
when
a
I was
professional sleeper. My bones have to be nice and strong. I love sleeping.
younger. I don't know if there's a study on how much you sleep with bone mineral density, but hey,
Yeah.
intriguing topic.
Yeah. So how about even just like last question, like protein? Is protein that's good for your muscles? Is it also good for your bones?
It is. Yeah.
Yeah.
Protein is good for all aspects of healing, right?
Yeah.
Muscles, bones, tissue, everything,
Yeah.
right?
Yeah.
You need protein to live.
Yeah. Yeah.
You can't just, even vegetarians need protein. They
Yeah.
get it from meat, animal-based proteins, but you need
Absolutely.
plant-based proteins. So
Yeah.
proteins are super important for everything.
Well, we've got some really great takeaways here today. I really appreciate your insight on this. It's great to hear from a joint specialist on physical activity and how it's really impacting our bone health. So really appreciate your insight.
Absolutely.
Yeah. So for our listeners, thank you for listening to another episode of Bad to the Bones. If you have enjoyed today's episode, make sure you subscribe and share this with someone who's going through the decades like the rest of us and trying to maintain some good, healthy bones. Until next time, keep those bones strong and keep moving.